Dr. Steve Marsden, DVM, ND, et cetera, et cetera, et cetera. I'll trip over the letters. Lectures for IVAS, the AHVMA, the AVMA, and numerous other organizations. He is co-founder of the College of Integrative Veterinary Therapies, CIVT, and is a director emeritus of the National University of Natural Medicine in Portland, Oregon. He's a contributing author to numerous textbooks and is author of the Manual of National Veterinary Therapy with Dr. Susan Wynn, an essential guide to Chinese herbal formulas published by CIVT. Dr. Marsden is extensively trained in alternative medicine, including Chinese herbology, acupuncture, and naturopathic medicine. In 2000, Dr. Marsden was named Teacher of the Year by the AHVMA, and in 2009, the Small Animal Veterinarian of the Year by the Canadian Veterinary Medical Association. So thank you all, and thank you, Steve, for being here. And while he's got his mic set up, is there anybody here from Texas who needs to sign in for their CE? Come see me after the lecture, and I've got the CE forms up here.
Thank you very much for coming. I know that there's a selection of talks this year that makes it hard to choose what you want to listen to, so I'm grateful that you guys decided to come and listen to me. Yeah, I've been doing this holistic medicine thing I was just sitting there on the stage totting it up in my mind for 31 years. So it's 31 years that I treated my first animal with something other than prednisone. That was my goal, is to find something other than prednisone to treat a skin dog with. And of course, now I've got Cytopoint and Apoquel and so my wish has been granted. I can remember cancer was intimidating. Of course, if you think back 31 years, there weren't a lot of oncologists, certainly not in Canada. And the other thing that really kind of, if you'd said, what's the high watermark for success in holistic medicine? It would probably be getting a dog that had been paralyzed up on its feet again. So, and there weren't a lot of rehab therapists or physiotherapists to help out back then either. So I think one of the reasons why disc disease bothered me so much is because for neurological problems, you can totally relate, can't you? Like you can just put yourself in that position and decide you just do not want to be there. I think the owners relate very closely to their animals too. And so what that means is you don't really have a lot of time to figure something out before the owner just decides they don't have the patience for this and they're going to pull the plug. So then there's that added pressure of having to be effective. And so, and certainly what I learned in veterinary college didn't take any of that pressure away, because there was the fabled golden hour. Anyone learned about the fabled golden hour? Where if you didn't essentially do surgery within the golden hour or some other meaningful intervention, then all was lost. That's probably paraphrasing, but it's not inaccurate, I don't think, with what I was taught anyway. So that means, of course, that if you're not going to opt for surgery or there's no one around to do the surgery, and that time passes, and in your mind as an owner and a veterinarian, you're automatically thinking, okay, the odds just got stacked against me. So, so disc disease was a major challenge in my mind. And I'll tell you that you can get all those dogs walking again. It's actually not technically difficult. But the problem is that it does require time. And so today's lecture is about helping you understand what I have recently learned about disc disease, so that in your mind you can feel like you can justify to the owner the investment of time. Because otherwise, so that they're less inclined to just suddenly pull the plug. Oops, what the hell's going on up here? Something crazy would happen when I was like, got to go upstairs, just one sec. Push too many buttons. All right. Sorry, did a small earthquake there? Kerthum. Okay. Your notes are fairly detailed about the theory part of things, so you don't need to worry too much about what you can't see on the slide. Sorry. I always get optimistic and then... But essentially, it is... even if a dog gets, of course, that was extra demoralizing, wasn't it? You refer the dog for surgery during the golden hour, and then they don't walk anyway, or they end up worse. Who's had that happen to them? Yes. So then you're that much more deflated, and not to mention the owner. So I'm here to tell you today that the take-home message is most of these dogs can walk, and they can walk even if it's been months since the problem happened. So we're going to talk about that. I am going to suggest it's a multidisciplinary approach. I use, at a minimum, chiropractic, acupuncture, herbs, and then to stop it from ever happening again, diet. I feel that the real food diet is essential if you want that dog to stop having disc blowouts. That was something else that I kind of inherited as a belief, is like if you got a dachshund, they're going to do it over and over and over again, which makes it that much more likely for an owner to just say, screw it, I don't have the time or the patience. You can totally prevent that from happening again. And, but the secret, the only way I have found to dramatically lower the odds of recurrence is to feed a real food diet. So we're going to talk about exactly how do these things get, what exactly gets pulled together, how do these things work, and in the case of herbs, which ones do you use? Because we don't always use the same thing. In terms of herbs, as Karen mentioned this morning, there's a few companies that we have advised upon or have a proprietary interest in terms of naturopath. You can look up these formulas in any classical Chinese medical textbook and even buy all the single herbs and make them yourself. So me talking about these products is not to tell you that you have to buy those products. You can totally source them or make them yourself. Okay. What is the thing that I found most intriguing? And I found this in the process of researching degenerative myelopathy. But what I found both encouraging and disheartening is that when a dog blows a disc and then they're just down for months, that's not because wiring has been completely terribly screwed up. That's not the issue. The dog is down because the dog says to stay down. I wish our dogs told themselves to stay down, but they don't. Anyway, so this was news to me. It's probably news to, I got a lot of this from spinal cord research in humans. And like I said, it's discouraging in the sense that you think about animals that you've maybe put to sleep over the years because it seemed hopeless, and then you realize after the fact, darn it, it wasn't that hopeless. But anyways, it's a curious story. When you have some sort of insult to your spinal cord, there's a secondary messenger that gets released inside the spinal cord, and that's neuronal nitric oxide. When you experience pain immediately after that, or immediately after the injury, and you feel a tremendous amount of nerve pain, that's actually a spike of neuronal nitric oxide. That spike goes away, it abates. There's a second spike. The second spike is due to white blood cells. White blood cells come into a damaged area, especially neutrophils, and they just start to release their various enzymes and start to do their free radical induced damage. And there's a second spike of neuronal nitric oxide from those white blood cells. When you have given corticosteroids, who's given corticosteroids in the past? Come on, admit it. Yes, everyone has. Okay. Still the drug of choice. When you deliver your corticosteroids, what you're trying to do, whether you knew it or not, is you're trying to subdue that white blood cell induced spike of neuronal nitric oxide. So why do we care about neuronal nitric oxide? Because if neuronal nitric oxides, we'll just call it NNO or whatever, if those levels are high in the spinal cord, it tells those nerves, don't fire. Just don't fire. As far as the spinal cord is concerned, if those NNO levels are enduringly high, there's an enduring source of damage. And if there's an enduring source of damage, the last thing you want to do is make it worse by moving. So what that means is that when we have a lot of disc dogs that are down 2 or 3 months after the injury, it isn't that you missed the golden hour. It's that their own spines are telling them, don't move your legs. Just don't do it. And they're telling it, effectively that's happening because of this enduring level of neuronal nitric oxide. One of the things that can make those NNO levels enduringly high, ironically, is surgery. If you do surgery in a dog that's sustained a fair amount of damage and has a fair amount of secondary inflammation, you can actually make those neuronal nitric oxide levels that much higher because they're already damaged and they're already having trouble healing that lesion, and then you create a fresh one, right? You do a hemilaminectomy and you might say, well, I'm not operating on the cord, I'm taking away, I'm basically taking away part of the spinal column. I'm not touching the cord, but it's inflammation in that general area and it fans the flames, and it tends to sometimes make those NNO levels that much higher. So when you've had a dog that got the surgery done and then they stay down or get worse, that's what happened. It's an easy fix, amazingly. So let's just go on with that. But first of all, or last thing I'll just mention is, what does prednisone do any good? And the answer is probably not a lot. Methylprednisolone sodium succinate is the only corticosteroid that is essentially viewed as doing any good in human spinal cord injury, and only in the first few hours following an injury. To just give corticosteroids for a week or 10 days, that's more just, we need to just acknowledge that as a bit of a desperate act rather than something that's going to be doing something meaningful. So what can we do that's meaningful then? Let's start by talking about a case. Excuse me, I got COVID back on the 20th, my birthday. Not only that, oh, thank you. Not only that, 2 years to the day that I got COVID the first time. I don't know what it is about my birthday, but at any rate, so if I sound a little hoarse or coughing or whatever, that's why. I'm just spreading COVID around the room. Don't worry about it. I'm here to tell you, don't bother getting the COVID vaccine anymore, because the virus is essentially a vaccine at this point. Not a lot of morbidity and highly contagious. Excuse me. So, who's using this microphone after me? That's the big question. Okay. Back to the topic at hand. Jack, an overweight 7-year-old pit bull cross with severe intervertebral disc disease. So this started in June. If you're going to have severe peripheral inflammation, the summer months are when you're going to have it, because everybody's peripheral circulation is amplified over the summer solstice. So it makes inflammation of your skin, inflammation of your ears, or injuries to your back that much more likely to be associated with severe congestion, bleeding, etc. He had an acute onset of a stiff hind limb gait and then delayed conscious proprioception. They went to the vet. Spinal rads showed a decreased disc space between T10 and T12. They went ahead and gave him everything except corticosteroids, methocarbamol, Onsior, and gabapentin, and it didn't really do much at all. So he progressed to complete paralysis overnight. He had a CT scan the next day, and it revealed a lot of damage. So extensive extradural left-sided T10 to T12 lesion There's a lot of compression of the cord, there's a disc extrusion and a lot of associated hemorrhage. It was a mess. There's also mild spinal cord compression from disc generation in neighboring sites, as well as a lot of calcification. And again, those are not future discs waiting to blow, not if you change their diet. They can revert back to normal, and we'll discuss how could that possibly be true with the next case. Anyway, despite all of that inflammation and damage, they chose to go ahead and do a surgery anyway. I'm going to suggest that if any of us in the room do these surgeries, does anybody do these surgeries in the room? Or are you going to refer them to surgery? Just wait until that calms down. Because again, just let go of the idea that there's a golden hour and that you have to just rush to get this done. Just let everything calm down. Use your corticosteroids if you want, your dexamethasone, your pred, your methylprednisolone, whatever it is, or I'm going to suggest some other things to you. Use those, get things settled down, then do the surgery if you're going to do it. And you will probably save everyone a lot of grief. Anyway, they went ahead, a pediculectomy at T11 to 13. They removed a lot of disc material. They decompressed the cord. They thought, yay, this is going to be a success. Oh, well, they didn't say that. They said the prognosis for improvement was estimated at 50-50. That's why I'm not a zoo vet, by the way. That's how I started in zoo medicine 30 plus years ago. Why I didn't persist with it was because 30 plus years ago, whether something lived or died in a zoo seemed to have nothing to do with a veterinarian and everything to do with just the roll of a dice. So I needed more feedback than that. So I would not have gone into spinal surgery, apparently, either. Okay. This is another thing I'm going to critique about that, is that there was no meaningful follow-up. There was no referral for a rehab or physio. There was just do the surgery, send them home. And fingers crossed, 50-50 lady, what the hell do you want from me? Like, that's essentially the attitude. So no practical physiotherapy advice was provided. And so no big shock. No improvements were noted. He remained paralyzed, incontinent. He didn't have any pain, at least. He had deep pain, fortunately, but he had a flaccid tail, flaccid limbs. He did have patellar reflexes, but no withdrawal, and he had no conscious proprioception. The owner said, if this incontinence thing is a deal breaker, like, we can put up with a lot, but we will not put up with the incontinence. That needs to end. So that was Sarah McKeegan. Some of you may know her from Upward Dog Rehabilitation. She was the physiotherapist that inherited this, and she's the one that reached out to me and said, help me so that we can save this dog's life. So here is Jack. This is not a picture of him 2 weeks post-op. This is a picture of many weeks later. And Sarah starting to work on him by, for example, stretching him over these balls, getting him to kind of lean forward to eat, get him in a semi-normal physical position, stretching over the ball, pushing with his little toes to try to grab a treat. Just one of the many techniques that people use. Anybody do physio or rehab in here? Does this look somewhat familiar? Yeah. Shout out to you guys. Okay. So on July 29th, I gave him something different. I gave him something that I give to all of these dogs that have no conscious movement in their back legs following disc prolapse. I don't do this day one, but certainly, what are we, like a month out, 6 weeks out or whatever? Absolutely, at this point, I'm using it. So it's a formula called Chai Hu Guizatong. That's minor bupleurum. For those of you that know, anyone do Chinese herbs in here? Anyone not do Chinese herbs? Okay, one or two. There's a formula called minor bupleurum. Easy to find. Actually, a time to heal in the room there has it. You can either, there's a couple things you can do. You can add 12 grams of cinnamon twigs and 15 grams of white peony per 100 grams of minor bupleurum. Or there is a pre-made over-the-counter version that you can get from the Gold Standard Herbs called Voltrex. So either one will work. And I use this for those severe, apparently hopeless cases where they don't have to have had surgery. They could just have complete lack of any sort of movement or sensation going on in their back legs. From a Chinese medical point of view, disc disease is a so-called pathogen invasion. So if you're lucky, which is going to be most of the time, the pathogen only goes one layer in. So that's, in Chinese medicine, that's called the Tai-Yang layer. And a pathogen invading the Tai-Yang layer is fairly easy to get out. And I'll show you how I do that in the next case. But occasionally, though, this pathogen can progress one layer deeper still. That's called the Shaoyang layer. And if the pathogen enters into the Shaoyang layer, that's when you get this complete lack of signaling to the hind limbs. And so we have to push the pathogen out. The way you push the pathogen, figuratively obviously, out of that second deeper layer is with minor bupleurum. But then you got to keep going. So the way you push it out of that other layer is with the cinnamon twigs and the white peony added. And you have to have both. If you just try to use minor bupleurum, they won't respond. You must have both the Tai-Yang or outer layer and the Shaoyang layer being addressed. So just 3 days later, and suddenly he was able to stand up his own, and the incontinence was resolved. So what happened? Basically, we talked about how corticosteroids are not a consistently effective means of lowering neuronal nitric oxide. But you know what is? It's bupleurum. Bupleurum, as a plant, has several studies showing this consistent ability to a consistent anti-inflammatory effect within the spinal cord. You might have been under the illusion that herbal medicine has no evidence base, there's no research, it's all just people throwing ideas out and seeing if it sticks. There's a ton of research on what these plants do in various situations, including spinal cord injury. And bupleurum has been shown to be probably the most consistently effective thing that's ever been tried to deal with neuronal inflammation. And we're going to come back to that in the second hour, those of you who survived the first hour. So by September 9th, then, you can see this is going to turn out well, otherwise we would just move right along. But Jack had been continent for about a month and was able to walk short distances without support. And now I switch him to the second formula that we're going to talk about, which is called Duho Jisheng Tong. That means pubescent angelica and loranthus, also a naturopath formula, but there are other companies that make it. As soon as the animal shows clear conscious movement, they can stand up, they're trying to take steps forward, it's clear that now there's activity going down the spinal cord. Now you can go ahead and treat them like a normal disc dog, which is to say, you're just treating them as though they got that pathogen invasion in that outermost layer. And so then they're fairly straightforward. The trick is to get the spinal cord firing again, and the only way you do that is if you lower neuronal nitric oxide levels. Okay, so that's Jack. Basically a couple of videos here. So here he is now, or not now, but when he first started to move, they got the help him up harness, and the owners were thrilled. I don't have the sound turned on, but they were just like overjoyed that even that amount of movement was visible after him just being completely flaccid. And then, whoops, somehow, not sure why this one's not going. But anyway, if it was going, if I wasn't having technical problems, you would see that now he's, just like a month later, he's walking straight down that runway following that other dog. So I'm not throwing Jack out saying, hey, look at this, it's one case, it got better. This is very consistent. This is no magic. This is something that you will be able to do in your own practices. It's a feature of bupleurum in that particular herbal formula. Anyone tried this on disc dogs? I know you had. How did it go? No, she says, no, don't do it. Okay, so Corinne sucks, but the rest of us, yes. So yes, while Sarah was not doing as much acupuncture, but if they happen to be with me, then I will be doing lots of acupuncture. He was getting consistent physio and rehab, and he was getting that Now, some dogs, normally that's about a 2 or 3 week phase that you have to use that chai hu gui tong, that cinnamon, that bupleurum and cinnamon twig combination. It's about 3 weeks for a severe disc disease to turn into a much milder disc disease. The exception is, was it type 2 Hansen's, which is the one that's like the more severe blowout. I know type 1 I think is the good one and type 2 is the bad one. It might be flipped around. Anyway, the one that we rarely see that doesn't have a lot of radiographic changes, all of a sudden one day they just have a blown disc and you can't really see a lot of spondylosis or calcification or mineralization. Those dogs are in that phase, this bupleurum and cinnamon twig phase, for a lot longer. Like we're talking months, let alone a couple of weeks. Fortunately, those are the rarity. So except for Corinne, most of us can expect to have there he goes. Most of us can expect to have these more pleasant experiences. Okay, he doesn't like to be watched. This is Bismar. If you were here during Karn's talk, the little dog in a prison outfit for Halloween, same dog. So Bismar is an 11-year-old male neutered Chihuahua, and he has paralysis attributed to intervertebral disc disease. Kind of a bummer of a story, because this is Lena Wang. You know that I've been working with senior dog rescues here in San Diego. She adopted this senior dog from a humane society, thinking, oh, I'm going to give him home. 8 days later, he blows a disc and he's completely paralyzed. And it's just like, as my father said, no good deed ever goes unpunished. So anyway, so she was rarely unhappy about that particular situation. It was an acute onset of paralysis in December, and the dog is suddenly unable to walk, defecate, or urinate, and just one day prior, he'd seemed fine. And he just, all of a sudden, he went out for a walk, and he yelped on his walk, and he came home, and then a short while later, he couldn't move at all. So they did an exam and needed radiographs at urgent care and said, well, it looks like he's got intervertebral disc disease. Let's give him corticosteroids. And obviously we're talking about him because he didn't improve. Over the next 3 months, the owner was expulsing his bladder every few hours, managing his fecal incontinence, and obtaining a wheelchair. This is like, what are you, 8 days into a new dog, and this is suddenly what your life has turned into. Yeah, exactly. So there he is in his wheelchair. This is pre-treatment. You can see there's not a lot of hind limb movement there. He's basically just dragging him around. And this looked like was going to be their new life together. She actually she was just fostering him this whole time because she wasn't sure that she wanted to actually officially adopt him, because she just didn't know where this was all going to go. So this is me working on Bismar. Chiropractic is extremely important. I understand who would be reluctant to do chiropractic on disc dogs. So a few of you. It's pretty much essential to find somebody. Now, there's a timing issue, so we'll get to that. But finding somebody who can do gentle chiropractic turns out to be pivotal for their improvements. So here's me treating him, and I put him on a real food diet, and I gave him this herbal formula, Du Ho Ji Sheng Tong, this pubescent angelica and loranthus combination. And sorry?
When did you start treating him?
I started treating him about 3 months after he'd had this. So it was about, sometime in March. And he'd had this issue in December. Yes?
Did you just say you started when you have conscious movement and you didn't seem to move at all?
So that video was from shortly after his injury, where he was not moving his legs. By the time I got to him, he have some leg movement. He just wasn't moving them a lot. But good point. So it's a laundry list of herbs, but there is a theme that runs through them, which is that the herbs have a lot of aromatic properties. So, and it's these volatile oils in that selection of herbs, which by the by is like a 1,400-year-old formula for back pain. It's the aromatic compounds in there have a vasodilating kind of effect. So they drive the blood supply to the injury, to the injured area of the spinal column and the spinal cord. That's very important to how it works. That's why we didn't use that in Jack right away, because what was his spine all about? His spine had this tremendous amount of acute inflammation and damage. The last thing you want to do is push blood into that injured area of Jack's spine. That whole area needed to settle down. We knew it wasn't settled down because weeks later, he still can't move his legs. That means neuronal nitric oxide levels are still high. That means the area is still very inflamed. We didn't need an MRI or a CT scan to tell that. So this would not have been a good idea to use this formula in Jack when I first saw him. Because if they're not moving their legs, then as you had suggested, they're not moving their legs, then that means nitric oxide levels are way too high. If they're way too high, they're way too inflamed. So sometimes these nitric oxide levels will come down over time, and if they start to move their legs, they're like, okay, so that's good. So why are things not happening here? What's the problem? Like the spine is allowing the legs to move. Why aren't you just getting on with this? That's what we're asking about right now. At any rate, so we drive circulation to the area and enhance that circulation to the spinal column to make it more supple. The secret to treating disc disease of this type is not to treat the spinal cord. It's to treat the spinal column, to just heal the collagen, the bone, the musculoskeletal tissues around the spinal cord. Don't worry about the spinal cord. Once there's a little bit of movement there, their spinal cord is okay. What we need to do is heal the spinal column. And that's what Du-Ho Ji Xing Tong does. It's not a neural anti-inflammatory. It's a spinal column healer. So
does it matter where it is, like in the column, or do you always use dual? Because I always think of that as a more like final.
yeah, the question was, this formula normally, as it's manufactured by most companies, works on the caudal or the low back. If you're a person, the caudal lumbar region if you're a dog. However, for knowing the kind of situations we find ourselves in, the naturopath version, I put in herbs that also address the thoracic and the cervical region to kind of give the formula reach throughout the entire spinal column. So that's a good point. There is an over-the-counter version that you can get as well called Lumbrex from Gold Standard Herbs. Some of you have heard of dogs being on Lumbrex, and you're thinking, what is that? That's essentially this Du-Ho Ji Xing Tong. So for mild to moderate disc disease in these small breed dogs, it's the go-to, and it's generally the only thing you need to give them so far as herbs are concerned. So in summary then, Du-Ho Ji Xing Tong, once there's any conscious limb movement at all, even if they stand them up and they can barely stand and they're staggering and then they fall down again, that's enough for us to move on to that Du-Ho Ji Xing Tong formula. Use the other one, the bupleurum and cinnamon twig one, when there's just nothing going on. Everything all right? Can you hear me?
No, you're good.
Okay, awesome. So we especially are attuned to thinking of this bupleurum and cinnamon twig version when they had a surgery and then they got worse, or they just never improved. There's a pulse that you can feel too. Generally, who does pulse diagnosis in their practices? One of the easiest ways to figure out, well, which one should I use, is how, when you're feeling the femoral artery and you're pushing in, like how soon do you feel the maximum beat intensity? If you're pushing in just a little bit, and all of a sudden there's a pulse and it's kind of big and it's broad or whatever, and then you push further and it's gone, that is a so-called floating pulse. You know to use Du-Ho Ji Xing Tong for that one. If, on the other hand, you're pushing in with your fingertips and you get to kind of mid-depth, and then you finally feel the circulation, almost like the circulation is trapped inside, you need to use this one, the bupleurum and cinnamon twig combination, to kind of get that dog unleashed, to kind of mobilize its circulation. Okay, so here's Bismarck one day after doing chiropractic and acupuncture. So you can see he went from no limb movement really to speak of, to suddenly he's got this very purposeful walking in his cart. Lena was over the moon. I mean, you take that cart away and he just can't do anything. But just that, just for her to have seen that dramatic shift just one day in was important. So what happened, I'm going to show you what the chiropractic did shortly, but let's just look at the rest of him. We continued treating him for another 4 months. So it's not to say that just because you can get these dogs better, that it's going to be all done and dusted in a month. It's going to take several months. But once the owner sees progress, then they're okay, right? And if they're not leaving a big mess around the house, then they're okay. By June, he was walking on his own without a wheelchair for short stints, finally able to urinate on his own. By September, completely walking on his own, running and chasing after dogs. And of course, now we're not January 20, now it's like a year later, and he's doing great. He's never had a relapse. So here he is. What's it was March 2016? That's March 2023. Anyway, so there he is, just like zooming around. Lena was extremely dedicated with him. This is what she would do for like an hour a day. She would just get him to follow her. He's very food motivated. So she didn't have any rehab or physios to kind of help her out. She just had food and a backyard. So it was, and the idea is just to kind of have him mentally engage himself in purposeful movement in order to get things going. So eventually, she would do that without the cart, and she would spend an hour just trying to put him, he was weaker on one side than the other. So he would obviously fall on the side that he was weakest on. So the first thing is to kind of flip him to the side that's strongest, and then to entice him up with food. And then he would stagger a few steps, and then he'd fall, and she'd flip him onto his strong side again, and he gets himself up and staggers a few steps. And she would do that for like an hour a day. And then, but she just kept at it. And so now he's pretty much back to normal now.
And still her foster, I'm sure.
She finally adopted him. She was finally, it took her a long time to be convinced that this was not just a brief break. He's about to kick that dog's ass, so you can see he's feeling pretty good about his chances. Okay, so drug therapy, corticosteroids, they don't do anything at this stage because neuronal nitric oxide levels are okay. They're not the issue as soon as there's some attempts at purposeful movement. The problem is this persistent spinal column stiffness. That's what needs to be addressed. And in particular, inflammation in the spinal column needs to be actively resolved. It actually has a specific term for it to kind of, when we take acute inflammation, it's supposed to actively resolve on its own. What does actively resolve mean? Up until the 90s, people thought that inflammation just went away. That you got inflamed because there's something your body didn't like, some antigen or whatever, and you mounted a response, and eventually there's no antigens left, and so it's just like embers in a fire, they just slowly die down and the problem just resolves. Once the 90s came along, they realized that inflammation never just dies. It must be turned off. And there are certain pathways, certain events that have to happen. And if those events don't happen, then inflammation just keeps going and it never stops. Corticosteroids are a great way of making sure inflammation just keeps going. Why is that? Why the cruel twist of fate that the thing we rely on for acute inflammation turns out the thing that dooms us to chronic inflammation? It's because that cyclooxygenase, the enzyme we're so fond of inhibiting with anti-inflammatory drugs, that ironically is also the enzyme that's needed to resolve inflammation. If you take it out of commission, which we do with most of our medications, then there is no cyclooxygenase to drive this second phase of things when we resolve inflammation. So that's why everything just stalls out in this kind of limbo state and why we have so much chronic inflammation. We really don't have chronic inflammation. What we have is suppressed acute inflammation and just a lack of progression to this resolution. To resolve inflammation, you need to bring the blood supply back. That's why Du-Ho-Ji-Shin-Tong works so well, is because it drives circulation to the injured areas. Okay, something else that impacts circulation on the cord is chiropractic. So it's reasonable to wonder if it's really all that good an idea to do chiropractic. Because you think, well, they're unstable. What if I make them unstable even more? What if I just, blow out a brand new disc? The best analogy for what is actually going on in the backs of most disc dogs is probably this method of snake restraint, where you put a snake inside a plastic tube. So the snake is writhing around in there, but the tube is not moving with them. That's essentially what a spinal cord does inside a spinal column of a dog with a whole bunch of spondylosis or degenerating discs. What? We're done already?
I missed the 10 and you didn't look at the
Oh, shoot. Okay. Wow. I guess I talked too much. Well, let me just finish this stuff, and then so far as degenerative myelopathy, I guess you got to read your notes. But chiropractic has been shown to actually, rather than make the situation worse, to remove impingement on the spinal column, or on the spinal cord, to actually take pressure off of blood vessels that are coursing over the surface of the cord. How do we know that? Because they've done pre and post MRIs of people and animals managed with chiropractic with real actual disc disease. And they can see the change in circulation. That's why Bismarck was walking so well just one day afterwards.
You have 9 more minutes.
I do have 9 more minutes.
Yes.
Okay, awesome. But okay, phew. Still, I better hustle my ass up. Okay. So don't worry about healing the cord in those animals. Worry about healing the column. Worry about healing this connective tissue. How do you heal the connective tissue? When you see connective tissue that is calcified, like the discs are, when you see spondylosis, which tells you that that collagen that's linking to that periosteum is now all stiff and lacks resilience, when you see that on an X-ray, just know it's a sign of blood deprivation. And all you need to do to heal that animal up is get the blood supply back. So Du-Ho-Ji-Shin-Tong effectively does that. Chiropractic effectively does that. A lot of these treatments that do that, they essentially step in to what cyclooxygenase was supposed to be doing and then says, hey, I understand you're completely irreversibly inhibited, but we know what's supposed to happen after this. We'll just make that happen. So a lot of plants have been researched for their ability to compensate for this disabling of cyclooxygenase. And so they produce compounds like, appropriately, resolvins or protectins. And these compounds are what actually mediate the resolution of inflammation, the return of the integrity of the blood supply. And then you just wait. You just wait, and all that calcification will go away. Because calcification, what is that? That's hypoxia. Calcification goes away when you bring the blood supply back. This sort of rigidity of the tissues that produces spondylosis, it stops when you bring the blood supply back. You will never take away the spondylosis deformans, but you'll stop it from getting worse. And you will take a disc that is brittle and likely to tear because it's no longer supple, and you'll restore suppleness to it so that it won't tear. But the main cause of this is diet. The main thing that damages our circulation over time, if it's not anti-inflammatory drugs, it's food. And it's the processing of food in particular. We need to actually make food a little harder to digest, a little slower to assimilate in order to undo the easy tendency towards this. There's a name for it. It's called endothelial dysfunction. Just think of it as malfunctioning blood vessels. To undo it, we need to feed real food. A lot of our therapies that we rely upon, if you are a physio, work through increasing endothelial nitric oxide. Acupuncture increases endothelial nitric oxide. And as Karin was mentioning this morning, it's that presence of nitric oxide that causes the blood vessels to start to grow and to dilate and to function normally and to allow edema to be siphoned off and free radicals to be siphoned off and for inflammation to resolve. Laser therapies, pulse electromagnetic field therapies like the Assisi loops, these all work by stimulating endothelial nitric oxide and normalizing circulation through the spine. And pick your favorites, but to stop it from happening in the future, there must be a diet change. To get animals going as quickly as possible, you should do chiropractic. You should find somebody who you trust who can do chiropractic nice and gently. You saw that I do it with an activator. So what about degenerative myelopathy? Just provide a context for this. Is it the same thing? Is it just really bad disc disease? No, it's not really bad disc disease. We tend to reach for the same things. We tend to reach for kidney tonics, for example, in Chinese herbs, that we think will help the back legs because we're always told in Chinese medical theory that they help the back legs. The back legs, if they're not moving properly, it's a Shaoyang pathogen. There's only one thing that actually gets rid of a pathogen in the Shaoyang layer, and that's bupleurum. So we know for degenerative myelopathy, we're going to be using some derivative of minor bupleurum. It turns out that if we use kidney tonics, we make the situation worse. It's not even a case of, well, we just weren't that effective. It's like doing spinal surgery, and now they're worse than before. You're better off to not use any herbs at all than to treat them like your average disc dog. What is the problem with degenerative myelopathy? They have a mutated enzyme called superoxide dismutase 1. You have an SOD2 and you have an SOD1. Superoxide dismutase is an enzyme that is, it's, as you might imagine, it gets rid of free radicals, superoxides, it neutralizes them. Great thing to have happen. Except that if you make the mutated version, it doesn't do anything for free radicals. What it does do is it actually clogs axonal flow. It creates a problem known as excitotoxicity. So in degenerative myelopathy, we have spinal damage and nitric oxide levels that we talked about. And neuronal nitric oxide levels have to be neutralized. The body says, oh, we need to activate SOD1 to take care of this neuronal nitric oxide, except it's a malfunctioning enzyme. So it doesn't take care of the nitric oxide. That's problem number one. The stimulus for the problem is still there. Problem number two is that in the mutated SOD1, it damages astrocytes. What astrocytes are, this green cell here, what he's supposed to be doing is taking those blue dots, which are glutamate, out of the synapse. So glutamate gets released, crosses the synapse. There's the action on the other end of that synapse. And then this glutamate is supposed to be taken up by this astrocyte so there's not too much of it. If you have too much, you start to kill the downstream neurons through a number of different mechanisms. That's what's going on in degenerative myelopathy. The mutated SOD1 is killing these cells or disabling them. Glutamate accumulates here and starts to kill off the downstream neurons. The whole name of the game in degenerative myelopathy is to get rid of that nitric oxide and to get rid of the glutamate. Unfortunately, our normal kidney herbs don't do either of those, and in fact, they increase nitric oxide levels in the spinal cord. So this was something that I eventually slowly figured out and created a minor bupleurum derivative for it, which your clients can buy online. You can stock it in your clinics. It's sold by goldstandardherbs.com. It's not just minor bupleurum with a few things added. I totally had to rework the entire formula. There's a spectrum of results that can be expected, ranging from nothing to stability to reversal of symptoms. So here's a reversal case. Axel, male neuter German Shepherd, 2015 model with degenerative myelopathy. Dr. Heather Sachs of Massachusetts was the veterinarian for him. Originally, she just did her usual physio thing, and although she, like most of us, struggling with degenerative myelopathy, was wondering if she was accomplishing anything, she was, because we have these established milestones, right? By 6 months, they're down. By 9 months, they're incontinent. Like, we know how this disease goes. And she was slowing the situation down. So he originally presented just for hind limb weakness and bilateral muscle wasting. She did what she usually does. She did laser therapy, underwater treadmills, did her usual thing. And he seemed okay, except that he continued to progress. He's not on a real food diet. He wasn't on any herbs at this point, except for turmeric, another spinal cord anti-inflammatory, dasaquin, and ligaplex. So finally, she thought, not improving. I better just see. She did a test, yes, positive for bilaterally or homozygous recessive, whatever it is, for the SOD1 mutation. So they continued doing what they do. She noticed a lot of active acupuncture points in the gallbladder meridian, the meridians that control the Xiaoyang. She was nervous about doing acupuncture, didn't want to make the situation worse. I see, I'm just gonna finish this. So she added in some chiropractics, but nothing really seemed to slow things down. Still, she got him to October before he finally needed a wheelchair. In November, she was taking a course from me. I said, go ahead and try this DM formula, which was still so new that didn't even have a nice label on it. I was still monkeying around. And within 3 weeks, he was no longer using his cart to walk into his rehab sessions. He totally got back on his feet. So here's what he was before the DM formula. So you can see that he wants to engage with the other dog, and he's got some conscious movement there, but he can't stand up anymore, and he can't particularly walk. So, and then this is him just 3 weeks on the formula. So he was able to stop using the wheelchair. They do pinch his tail to kind of keep him thinking about his back end, but you can see that he's walking much better. So he continued to improve. So he's an exceptional case. She actually helped me do the original study. She had like 8 dogs. We divided them into 4 groups, doing a little clinical trial. She contacted me 3 weeks in. She said, can I just put everybody on the new stuff because this other minor bupleurum stuff is not cutting the mustard. So we put everybody on the new one. And she continues to have good results to this day. Diet is important in DM. So one thing that doesn't change is the real food diet, because we need an antioxidant effect inside the spinal column. And that's how you achieve that. You achieve that, an anti-inflammatory, antioxidant effect, you achieve it with a real food diet. Okay, I'm going to wrap it up. And then if you guys have any questions, you can come on up at the end, or are we okay to take some questions? Or you're all right? Okay, yes, go ahead. So there's several things that were added to the minor bupleurum to begin to tackle the glutamate. So one of the things that's added is Da Huang. One of the things that's added is salvia. One of the things I needed to do was completely change the ratios of ginseng and Pinellia. So there are a lot of things that I changed. So it's not, like I said, just taking minor bupleurum and adding some things and calling it something new. It's a completely redone, licorice is taken out of it. What I'm looking at now is something to resolve the spinal cord injuries, to bring that blood supply back without doing that whole nitric oxide business that just messes things up. The formula I'm testing now that you can try out yourselves if you want. I have no idea if it'll work for you. I got one dog so far, a boxer that started to walk properly since I started using it. And that is, I'll spell it for you, Xian, Xian, Fang, Xian Fang. Next word is Huo, Ho. Next word is Ming, Ming. And the last word is Yin, Yin. Xian Fang Ho Ming Yin. Now, normally a Time to Heal has that, but they're out of stock. However, Con Essentials has a booth in there. They sell it as Sublime Joint Formula. Sublime Joint Formula. So you can go ahead and get that from them if you like. Evergreen makes a Xian Fang Ho Ming Yin. However, it's not designed, or the ratios are totally off, and so I can't really use that one or suggest you use that one. Question? I'm trying it in addition to DM formula to get more of an added anti-inflammatory and inflammation resolution effect. Go ahead.
For this dog in chiropractic, are you basically waiting to get the do how to do change come? Or are you starting it when you have them on the referral?
The chiropractic, when am I starting the disc dogs? When am I starting to treat them? I will start them even when they're on that bupleurum and cinnamon twig formula. I will start to take the pressure off. When I will not do chiropractic, and we'll talk about this in the next hour for those of you who are here, is in the first 48 hours or so. I generally try not to use any chiropractic, let things calm down, settle down. The period when you would be most apt to use corticosteroids, like dexamethasone or whatever, that's the period that I don't come at them with chiropractic.
Let's give Steve a 5-minute break before the next lecture.
Okay. Thank you.